Here at Face Doctor, we recommend Obagi Tretinoin when we're adding tret into our regimes, and there are 3 different strengths of that. There is a 0.025, 0.05 and 0.1%, and they look like this. I don't have the 0.025 with me today. So most effective results are gained from the 0.1%, but you're more likely to get reactions in the skin, some sensitivity, peeling, dryness and redness, and your skin expert will counsel you through those. There are lots of different ways of managing anticipated reactions. But you'll always come through the other side and acclimatise. And if you've got tolerant skin, you can start straight on this as long as your skin's well prepared and you've talked about it with your skin expert. For people that don't think they'll be able to tolerate the reactions so well or want to start a bit more gradually, then the 0.05 or the 0.025 can also be used, and slowly we would build you up to increase the percentage of tretinoin in your cream for more results. Tretinoin can be used for lots of different benefits in the skin. So it increases collagen and elastin, which most people are aware of, but the other use that we have for it is to reduce oil production, particularly in acne-prone skins or active acne. And we also use it for hyperpigmentation, and it can increase the efficacy of hydroquinone used to reduce pigmentation and purge it from the skin. The tretinoin can assist with that. So it has multiple uses. It's obviously a very active ingredient, so it's really important that you are prescribed by a doctor and you have very clear guidance from your skin expert on how to layer it.